Hello everyone, welcome to the Digital Health News CXO podcast. Today, I have the pleasure of speaking with someone who has had an extraordinary journey across two industries, hospitality and healthcare, that on the surface may seem quite different. Our guest today has over 20 years of experience, has been a leader in both these worlds. She spent 16 years honing her skills in customer experience with India's premium hospitality chain, the Taj Group of Hotels. In 2013, she made a leap to healthcare with key roles at Manipal Hospitals, Fortis Hospitals, and CK Birla Hospitals, where she managed patient experience across India. Currently, she heads operational and service excellence for Preventive Healthcare at India's largest hospital chain, Apollo Hospitals. From managing experiences in hospitality to transforming patient care systems, she has mastered the art of keeping the customer at the center of everything, no matter the industry. And now, with the focus shifting towards preventive healthcare, she is working on the next frontier, using technology like artificial intelligence, machine learning, and big data to enhance patient experience. We are here to explore her journey, her experiences, and why operational excellence is critical to delivering better preventive healthcare. We are absolutely honored to have with us Ms. Archna Gupta, Operational and Service Excellence Group Head at Apollo Hospitals. Thank you so much, ma'am. Thank you so much for joining us today at Digital Health News.
Thank you for the privilege for participating in this, Aarti.
Ma'am, as I said in my introduction, your journey into healthcare seems quite interesting. You spent 16 years managing customer experience in Taj Hotels, the premium hotel chain in India. And then in 2013, you sort of had a shift to healthcare. Would love to know, ma'am, since both of these industries are sort of service-based, what are the differences that you see in both of these industries? What was your experience?
Thank you for the question, which always, I also all the time reflect upon what was my exposure in Taj. Taj is known for its service of customer centricity. I think I cannot fall short of talking about 2611 scenario, wherein the staff employees knew the escape routes, yet not a single one left just to protect the guest over there. So that kind of a DNA, they put their lives on stake also, and that kind of a customer centricity. I mean, I'm coming from a industry. I'm coming from a group which is not just patient, which is like, I mean, it's really amazing how the systems, an ecosystem, drill down in the DNA of every person over there from that customer centricity. And I guess I got a privilege to learn a lot from various angles how they drill it to be able to contribute in the healthcare industry when I came, wherein I found that while there are a lot of innovation has been done in terms of clinical excellence, but when it came to, the patient experience, a lot on non-clinical front, a lot needed to be done. And I guess that's where I felt I could contribute with my exposure and background. And the industry also was looking for such resources. Way back, I joined in 2013. And I guess Apollo, in fact, was the first one who started looking out. And there was a change, not just in Indian healthcare landscape, but also in US, wherein where the reimbursement used to happen by the insurance based on clinical outcomes, they also started putting in patient satisfaction scores for reimbursement. So suddenly, all across the world, they started looking out for resources from other allied industries, service industries, to look into the patient-centric beyond clinical outcomes. So that's why we also felt that India, before joining the healthcare, I felt that India being the lowest cost provider and having the talent pool of doctors and all, still, it has a huge potential for medical tourism. Yet we were losing out to, other places like Thailand, Indonesia and all, just because this, the comfort factor to the patient and the family member was not being looked into the way it should be. And I guess 2013, I joined Manipal Hospital. A lot of work needed to be done. I can kind of Service industry, the ethos is same. Customer experience. So it is not, we moved from goods and services economy to experience economy long time back. And I found that in this industry, a lot of work needs to be done because they felt that the patient is coming for only disease management. That is the core. Doctors are the best and we are giving the best clinical outcome. What else? So why would we even look into small things like their family member care or the food that we serve, and that needed to be brought about, from various levels, right from the senior management to down the line, to understand that, it is a lot about awareness that these are also very important for them to take decision to come to you and really make them comfortable, including your visitor is equally important than just the patient who is there. So those kind of, that change management had to be brought about.
Right. Ma'am, you spoke about change management. We always talk about this when we talk to CIOs, when they introduce new technology in a hospital, whether it is EMR, EHR or HIS system. So there is a clear change management that is needed when it comes to new technology. But when you talk about patient experience in healthcare, it's a whole new concept. It's not just a part of technology. It's a whole new concept that has to be drilled down not only in the healthcare providers, nurses, but it has to go from top to bottom. So when you took on this job in Manipal, later on you moved to Fortis also and CK Birla Hospital. Could you walk us through some of the examples, some of the anecdotes from your experiences, your past experiences, where you had to, start from the scratch in the change management space?
Great. Thank you so much, Aarti. I think the first thing what I started doing was looking at the customer feedback, which was not available when I joined 2013. The data used to come to us only after end of the month, and that too very fragmented. And I was in the corporate office managing 10 hospitals. So I think my starting point was customer, what are they giving us the feedback? How can I, using technology, how can I get not just the scores, but what are they telling us? And how can I even make the survey more meaningful? Started with that survey only, which was earlier made on basis of what they had the lead metrics, shifted it to what matters most to the customer. And make it very easy for them. Within 5 minutes, can they give us feedback and unbiased feedback? And how can we, get an instant alert to be able to do spot rectification then and then and take care. That was a starting point to really cull out at all levels, from senior level and all that. What are the biggest pain points? What are they really the top recurring complaints which is coming in, so that we can prioritize our focus on resolving those. And I'll give you some basic examples of, what, when I started, for example, every Monday and Saturday used to be a lot of crowd coming to the main flagship hospital for the doctor consultation. There used to be kola going on right from parking to waiting area and enormous complaints. And the grievance officer was always busy on those 2 days, only managing complaints. And we felt that, and when I looked into, we found that 70% and above are walk-ins. So I looked into why is it that nobody's calling up to, book an appointment and come. When I started the journey, when I also tried to do an audit myself, and I said, it was so difficult to connect with the call center, the unit call center. If I was lucky enough to connect, they will transfer me to department. The department person again would be busy with guests, all that drama, because the call center didn't have any roster for the doctor to give me appointment confirmation. So I think my journey started with that. I said, I have to convert these walk-ins. Invariably, they were not able to book appointments, so they were coming as walk-in. So that's why 70% and they were complaints. And I needed to fix this. We started from that journey to a centralized call center helpline pan India, wherein every doctor's roster was available at centralized area, and one number was given for appointment helpline wherever they want to go, and made sure people come walking in with appointments versus walk-in. They were getting more privilege so that more and more walk-in appointments would be booked, and better management staggered these people to come throughout the day instead of everyone crowding up first thing in the morning and waiting endlessly. So reduction in complaints happened from 70% walk-in, we came down to only 17% walk-in within few hours.
That's a wonderful number.
Yeah. And reduction in complaints and, patient management. I'm just giving you one example. This was that era where we worked on it. Various discharge, for example, discharge was always delayed. The coordinator would be manually finding out where is it stuck. We worked with technology to get a, view of every discharge that happening in every hospital and which process it was stuck in, so that they will call up the right person only to expedite it. And some triggers and some checklists would be made. So technology, I think I use extensively in order to make the leap improvement and not incremental improvement. And with the customer feedback, again with technology, real-time feedback was available. We could do a structured review so that there was we instituted a rhythm of continuous improvement niche unit based on the feedback received. These are some of the examples I'm giving, which was the foundation across the hospitals for everyone to look into what is a patient talking about beyond clinical outcomes to work upon to make things easier for them.
Absolutely. First thing that a patient sees in a hospital is basically the clinical excellence. But after that, what you can do to improve his experience in a hospital beyond that clinical experience is something where your role plays a major part. Just would like to understand, in last 1 decade, you talked about the call center part. Now we are in an internet era. Now we are going to 4G, 5G, and then we are also moving towards the artificial intelligence. In the last 1 decade, how have you seen the industry or the customer experience or sort of customer demand transform in terms of what they demand from a healthcare organization or healthcare providers?
So, there are various places that we use AI also. To start with, again, I will take the call center booking appointment process. Now, many people don't want to call up, and book. They have a lot of queries before booking appointment. And many a times when they call up, they are in, when they are free in the night, and maybe our call center the resource would be very minimal, who may not be well trained and all to answer all the queries. We came up with the web bot, web assist bot system. You have to really appreciate, unlike other industry, where if I go to banking industry, it's very straightforward, A, B, C solutions, and then they will provide answers to it and people can go for transaction. But if healthcare, people come with queries like, I have this symptom. Who do you think I can, meet up? It's a medical way of triaging, which is not simple, algorithm given. So a lot of input from the clinical team in order to, if this is, what are the 3-4 more right questions to ask before you tell them, okay, this is the doctor to meet or this is the department to go. So that bot uses entire algorithm and natural learning. So they will not type exactly the word. So the latest technology, I'm telling you, really helped us to improve everything. When I talk about AI, we are using extensively in Apollo Hospitals today to look into they predict the risk analysis. Today might be healthy, but based on your current, whatever findings are, chief complaints and the family history, they can predict your AICVD scores, they can predict your, what can be a diabetic. So they can predict with the AI. So it is, in Apollo Hospitals, they use the AI algorithm based on huge data set of Indian database. It's been there for more than around 40 years. So they have a lot of database which is Indian. So it kind of really has an accuracy level of 90%, almost 89%. Unlike other frameworks used in the US, which is much lesser accuracy. So that, there is so much being used for the patient at various aspects and various, be. I mean, I can go on and talking. I will not be able to stop. There's so much being used.
Absolutely. At Apollo Hospitals, you're heading operational and service excellence in preventive healthcare domain. Would just like to know what exactly, when you talk about preventive healthcare, what exactly do you mean? Because even today, a lot of people, like you rightly said at the beginning itself, people look at hospitals as a disease management center. So what exactly you mean when you say preventive healthcare, and how is Apollo what Apollo is doing differently than other hospitals? Because I assume that other hospitals in India might also have preventive healthcare departments. What exactly is Apollo doing differently in this domain?
Thank you for asking this question, because this preventive healthcare is very close to our chairman, Dr. Pratap Reddy's heart. He is a visionary leader, as you would know. And we can understand that there's a growing rise in deaths due to NCDs because of lifestyle diseases, which is happening. And by 2030, we'll have more than 70% out for, deaths because of NCD. It's already alarming rate is increasing. And he's well aware about that, and he wants to wage a war against it. So for him, preventive health is the way to go. He wants us to spread the awareness, make sure everyone screens it early, detect them early enough so that we can prevent and not come to the hospital for management, disease management. Don't be too late. That is his vision. And any other, when they go to business organization, every year the targets for every other division is incremental, say 10%, 12%. For us, he sets target as 2x, 3x and all. How many millions have you touched? How many millions have you spread the awareness to? How are you making everyone undergo this early detection screening test? That is his vision. And Apollo, while there is health check department in most other organizations, here there is a constant focus because driven by him. Constant focus. So we have done a lot of innovations in this segment, right from AI. We are the only ones who are giving the AI driven, predicting the score. We are also the ones who have, if you go to any other health check, any other organization, they will give you standard health check packages. So one needs to choose which package, and whatever they will look at price point and the inclusion, somehow a lay person will choose. Here we have come up with a personalized, health check, wherein by sitting at home, filling up few questions only, you will be able to get a customized health check package, which is only meant for you. So you do not miss out on certain tests, which is very important for you, nor you do undergo a test which was not necessary for you. So it's like hyper local personalized package, which has been introduced for them. We've also created health check on wheels. We have a bus which has been fabricated with all the equipments like X-ray, mammo, everything, which goes to those, corporates at the doorstep and does the health check. One of a kind in India. So we are not even we're able to cover a lot of people there who were not able to release their blue collar jobs for the health checks, go to the hospitals and get them done. We're able to go to their doorstep, because otherwise they're able to limit it to only blood tests being done, or maybe portable X-ray, but nothing more than that. So this bus, which is equipped, is able to cover the right ratios, all the parameters which are required to be looked into is going to the doorstep. And that is the innovation that we're doing. I mean, I can go on talking. So this much is a focus, which is, there is, a patient is able to see, we also a health record in the app, and is able to see the trend. If he's done, last year and this year, besides the fact that he has an entire report on that app available any point of time, they're able to see the trend in the parameters. If they, suppose the doctor said, okay, check your, blood sugar again after a month or 2 months, they can see the entire trend in that report. So that EMR, EHR, what we talk about is all available.
Patient today is also a person who has access to several apps, other apps like food delivery apps. So he has different experience from a food delivery app where they reach to him at his doorstep. He doesn't have to go out and go to the store now or to the restaurant to, place an order for a food item. maybe today he also wants something similar from his healthcare organization as well, not for him to go out to the hospital and then figure out which doctor to meet and all those things. He wants the hospital to reach out to him where he is. In that terms, how is technology helping you, transform this experience for your patient?
So if you would download the Apollo 247 app, you will get all the answers. I think this is the only organization which has integrated not just pharmacy. You can get medicines at home, which is faster than even, other players in the market. You can actually book a video consultation. You can see your health records. You can book an appointment and so on and so forth. There's so many things to do in that one single app. And even if you go to Apollo clinics, there are many various verticals inside Apollo also. Wherever you go, even if you get a single small test done years back in a clinic or anything nearby, everything will fall into that app.
How have you seen the adoption go up for apps like these? Because I believe every hospital today wants to have an app like that. But what also matters is the adoption from the patient side. So could you just talk about that a little?
The app needs to be really holistic and useful for them to go time and again to use it. As I said, for simple thing like, or placing order for medicine, which is most often, requirement, or a small blood test to be done at home, or any consultation to be done, if they're not able to go. Our entire platform is available there in one single platform. So the usage, how are you building your app to become like one point for everything and not download several apps? That is the key to it for the adoption. And of course, awareness by at every touch point when they go to OPD, there is some kind of awareness, somebody prompting them to use it. That also increases awareness for downloads and adoption.
Right. Ma'am, we spoke extensively about preventive healthcare, the technologies that Apollo Hospital is using. Can you share a recent example, a real life incident where, a preventive healthcare or technological innovation significantly improved the customer experience at Apollo Hospitals?
We created this personalized health check package, which is like a delight. They can sit at home, answer the 9 questions and get a package for themselves. We created also recently, we found there's a certain segment which is looking beyond just blood tests and few tests. They're looking for latest advanced, with proper testing and research done, like genetic testing, gut microbiome testing. And, we've introduced those also, and hand holding to the guest for the path of wellness. For another thing I missed out telling you is in Apollo and Preventive Health, we don't leave them by just one health check. There's a care continuum given. There's a centralized health mentor, team pool there who are with the patients post, because a doctor may say prescribe for the lifestyle. Okay, you must do this, or you must check again, or you after 3 months, check, go and consult, or come back to me. So there's this whole care continuum team which is there with them to keep nudging them, keep informing them, keep guiding them. So that is another specialty, which is helping based on the severity. So if it is really high severity, there will be more frequent of, consultation or nudging for them. So that helps them to be in the path. And for some discerning guests who want really, because behavior and lifestyle doesn't change just because by one consultation, they need baby steps to move on. We have this 3 months, we introduced the Zen program, wherein after all the high advanced tests that they want for cardiac markers, for, cancer markers, they want help to improve. So there's a dedicated team of lifestyle counselors and, the physicians who will be in touch with them on a weekly basis to help them move baby steps to be able to go to a sustainable goal, health goals. So, and the bus I spoke about for the corporates, which goes to them, and the 24/7 app, and many more things that we're continuously improving upon and introducing. We started also, besides the health check normal, we also introduced, assessment screening on cognitive skills, on the sleep assessment, on mental health well-being. All those are included in our normal if you go for a whole body health checkup also. So every day we're coming up with new innovations, giving whoever wants, giving the best to our discerning customers, to our discerning patients and guests. I won't call them patient, I'll call them guests.
That's actually a good terminology, because whenever we talk about customer experience, we always think about whether we should call patient a customer or not. A lot of people take offense that we call patient customers, but I think this word sort of combines both of it. Guest, they are the guest of the hospital. Preventive healthcare is sort of all about staying ahead of the curve. At Apollo Hospital, you're already working with artificial intelligence tools, NLP, and big data. How do these technologies help improve preventive healthcare and patient outcome? Also, just wanted to touch upon one more aspect of artificial intelligence. Today, there has been a huge debate around whether artificial intelligence will eventually overtake doctors and healthcare providers. But from perspective of where AI stands today, it is more likely helping towards the operational part of the healthcare. How do you see artificial intelligence improving sort of experience for doctors also and for patients also?
As I said, for doctors, this predictive score helps them to, understand, because doctors are looking at reports, they're looking at history, but this is already giving them a prompt. They will, of course, it doesn't override their decision, their understanding of it. It kind of gives them a support for them to analyze it further and give them. There are various tools which have been embedded in our system for doctors to be able to, for example, whatever recommendation, when they look at reports, whatever recommendation that they give, there's an auto recommendation also so that they cannot miss out. But ultimate final decision doctor, but it kind of prompts them with AI. These are the findings, and in case they miss out, they cannot miss out. That reducing the missing out thing. In terms of operational, as I said, counseling of packages become like earlier. Someone had to counsel, make it personalized. And it's very difficult to train a manpower to tell them, okay, how would you judge? And obviously they will constantly send them to doctors only for personalization. So it was eating away into their time zone. Yeah. So here we have a package. So you just fill in the 9 questions and you will get a package made for you. I can go on. I think now we are exploring a platform for even training the resources, wherein with AI, someone can give them, they can upload the videos of how to interact, how to, present themselves and give them a feedback on. AI will give them a feedback, just like we've got platform for interview, people who are appearing for interview. They get feedback through AI. So we are trying to use those platforms for training the frontline, employees. I can go on like that. There's so many use cases we are exploring, we are using, and so many things are happening. For dashboard also, how the analytics that we look into, we're moving. We're just not restricting ourselves to Power BI. Something with AI. If we ask questions, can it bring us a better analytics for than limiting ourselves to what is there today?
So, what do you think? Today, from the perspective of awareness among the people, where does the awareness stand for preventive healthcare? And also, what are the challenges in front of you as a service provider, as a healthcare provider?
Okay. When it comes to preventive healthcare, I would say there's a myth which is going on amongst even the most educated people. They feel blood test is enough for them to know how they are performing in terms of it. I think that's where the challenge is, how to spread awareness that blood tests are not enough. You need to go for certain X-rays or, other tests of mammo, for example, for women once in 2 years to check for the cancer. So blood tests will not help. Only blood tests will not help. It has to be a combination. One is that in order to spread. And I guess the second is, everyone knows they need to go for check, but they tend to procrastinate. I also used to. Okay, I'm healthy today. Let me procrastinate until it becomes just comes as a rude shock to, someone today, and then they've themselves find that situation, which comes as a surprise. I think that we're trying as chairman's vision is to spread the awareness and reach out to them. Don't wait in many ways. That is there. And lot need to be done in this field. Lots of education, lots of workshops. In healthcare space also, we had done, while even if for disease management, we had started something called patient family member education. If somebody has been, we found that the caregiver is also there, and suppose they stay there for 4 to 5 days, the caregiver is the nurses would come and doctors would come and treat the patient and go away. We found this is a space where the caregiver can be educated on certain things so that they can take care of the patient post the discharge. So that gave a huge traction, and we found a lot of relapses coming down, clinical outcomes. That way was delight. And the family members felt more empowered to take care of their loved ones when they post-discharge. And in that field also, we're doing a lot of innovations, in terms of how do we make it, how can we reach to different segments? Not the segment only who's tech savvy, but the ones who are not tech savvy. How can we make it more easy and for them to take care of the loved ones at post-discharge? Can we form a community? Can they come back and they talk? So lots is going on, and still a lot to be done. That's all I can say, Aarti.
Absolutely. Thank you. Thank you so much for this conversation, ma'am. I think we have all got a bird eye view of what Apollo is doing in terms of preventive healthcare and how they're integrating technology into all of these initiatives. Thank you so much for this conversation. And looking forward to also sort of meet you in person maybe next time.
Sure. Thank you so much, Aarti, for asking so many questions that we're working on. And I hope we're able to spread the awareness to each and everyone the viewers, that they should go for the health check once in a year for sure, a proper health check, full health check. And we are there to support.
Absolutely. Thank you. Thank you so much, ma'am.